morning, Martha. My name is Marie. I'm going to take care of you today. I'll make sure I provide some privacy. Let me first just look at your name and date of birth. Can you tell me your name and date of birth? Perfect. That's what I have here. Let me wash my hands real fast and then I'll be able to take care of you. I just checked the order. The physician wants us to insert a catheter and then remove the catheter later today. So are you in any pain today? Zero? No pain? Good. Okay. Are you okay with what we're doing today? Okay. Any questions or anything? All right. So I did check, like I said, the order. Let me first just check your abdomen real quick. Any tenderness or anything? No? Okay. All right. Well, we'll get the catheter in. Do you have any medication allergies that I need to know about? Iodine, betadine, anything like that? Okay. We do use it when we clean. The first thing I'm going to do is put on some gloves. And I'm going to just do a normal peri-cleaning for you. And then we'll do a sterile insertion of your catheter. All right, so the first thing we're going to do, and I'm going to try to keep for as much privacy as possible. I'm going to first use soap and water wipes or peri wipes, and using a new piece each time, go outside and down, both new piece, and the middle and down, and then we'll discard of that in the garbage here. All right, so she is all clean, and I would have a chuck under there if it was going to be wet or messy. Now I'll do a glove change and get ready for my sterile procedure. So this is my sterile kit here. And I'm gonna just make sure I have everything in the sterile kit. Have a little garbage if I need it on the bed there. Check it. I'm just touching the outside here. Okay, get my gloves out. And this is sterile still. We will go right here. Thank you. Be very careful here. All right. I'll fix that in a minute. And then under the cuff here. These are a little tight for me. It's okay. I'm only touching the outside here, sterile to sterile. All right, that's my garbage. All right. Okay, now using the Judy technique, I'm going to take this and fold it. We're gonna tuck this under her. Be careful not to touch the patient. I had the patient assist me by lifting her bottom. And now I'm gonna take the fenestrated sheet out and cover her with some privacy. Being careful to only touch the outside, shiny side down. Still doing okay? Perfect, okay. Okay, and I'm just gonna inspect, make sure I have everything I need here, and everything in here is sterile. So I'll get my kit out, and looks like I have everything I need. Okay, so the first thing I'm going to do, make sure I have everything. Here is some lubricating jelly. And I'm gonna first put that in this tray here. I'd actually do a little bit. Okay. And then I'm going to open the catheter. And I'm just gonna inspect it to make sure it looks good. Okay, so now I'm going to take these wipes and while I soak this in my lubrication, making sure it doesn't touch anything it's not supposed to here. Okay, and now I'm gonna clean the area. So I'll first open these. I'm not gonna do it on this mannequin, but I'll open them, and then I will use my sterile hemostats to clean. So to do this, and at this point now my left hand is gonna become contaminated, I will spread the labia, and I will use one iodine pack and clean one side of the labia, dispose, clean the other side of the labia, dispose, and then clean the middle, dispose. And now I will insert the catheter. Okay. You might feel a little pressure here, okay? Just take a deep breath for me. Breathe in. And as soon as I see urine, I will stop and hold it with this hand here. And now I'm going to insert the water into the balloon. And this, my hand will stay here. I just don't know how to. There we go. Okay, lock that in. I'm very carefully holding this on the patient. Any pain? Okay. And the order said to put in 10 mils to inflate the balloon, or 5 actually. So we will just do 5. Perfect. All right, the balloon is inflated, and I can check it's snug in there. Okay. All right, and now we are done with sterile field portion. So now I'm gonna do a glove change. And next we're gonna obtain a sample of the urine, but first let me get new gloves on and attach it to the side of the bed and that sort of thing. And I did wash my hands just now in between these glove change. So, and I'm gonna verify the order to make sure we're needing to discontinue. I wanna make sure we don't put her through that if the provider doesn't want that. So we will secure this to the leg. And then Martha, we wanna make sure too that you understand the reason why we did this. Do you know why we put this in today? Yeah, okay. So just a reminder, if you feel any discomfort or anything, to let us know, okay? We want you to tell me if there's anything bothering you. And so you'll tell me, can you tell me what you'll look for symptoms of? And make sure you tell me if for some reason somebody comes in and the bag gets moved above the bed. Okay, we wanna make sure we have it attached here, hooked on the side of the bed. And we'll be monitoring very closely the intake and output of this, of your urine. So the nursing assistants will help with that, but I will also come look at it. We're gonna look for any blood, any dark urine, and that's probably why we're doing this sample today. So for the sample we're gonna obtain, I'm gonna first clamp your catheter up here with these cool hemostats. Still okay? Okay. And I probably will also have taken this off. All right, no tenderness or anything. Okay. And in a lot of facilities, they let the urine gather for a little bit. But now we will obtain the sample through here. I'll use an alcohol wipe and clean this area, make sure I have a clean syringe, and then I will pull the urine And then I will drain the urine into here. And then I will send this to the lab. All right, we will take that to the lab. Okay, any discomfort or anything? No? Okay, perfect. So I'll make sure I unclamp this. We don't want to keep it clamped for very long because the urine will back up. So Martha, I did just double check. We do have an order to discontinue your catheter. So I'm gonna do a glove change into new, just clean gloves is okay. And I did make sure we have a label on your catheter with my name, initial, time, date, and everything, so that somebody that comes in knows that I put it in. So are you in any discomfort or anything? No? Perfect. So now I'm gonna discontinue the catheter. Thing is still below the bed, the bag, and I'm gonna first attach this and make sure my patient's doing okay. And I probably have already obtained all the vital signs and everything just to make sure no discomfort, ask for pain, anything like that. So my new gloves I have on, we're going to discontinue her catheter. I'm gonna drain the balloon. Okay. All right, and can you take a deep breath for me and I'll pull it out in one fell swoop. All right, good job. And I'm gonna inspect it just to make sure it looks good and whole. And then I will discard of this in the garbage, boop, boop, garbage. And I will clean up all this area, make sure I get her all set and in privacy. Okay, any pain or anything? Okay, make sure you tell me when you go to the bathroom the first time, and I'll probably just maybe go with you and make sure that there's no trouble, okay? So use your call light if you need anything. I'll make sure I go document this and make sure to tell the doctor that you did really well through this procedure, okay? All right, I'll make sure you're comfortable and I'll be back in a little while to check on you. Knock, knock. Hi, Martha. My name is Marie. It looks like we're gonna be inserting an NG tube for you today. So let me first provide privacy and then wash my hands real quick. And then can you tell me your name and date of birth, please? Perfect. Okay, Martha, so are you in any pain today? No pain? Okay. I did just verify the provider's order. He wants us to do an NG tube and with suction and get some stomach contents out. It might be a little bit uncomfortable, but it shouldn't be painful. Okay, so we'll get everything set for the procedure. I have everything set up. Let me first do your vital signs, and then I will get a pulse ox on your finger here and keep that running this whole procedure. Are you able to swallow okay? Okay, and we'll check your gag reflex as well. And Phil, make sure you can swallow. All right, and now I'm gonna check your nose, your nostrils for patency. Make sure they're able to see which one is a little bit better to put the tube down. Yep, perfect, okay. And then I'm also gonna check this tube for patency by pushing some water through it. So just gonna push some water through it into a trash can, all right. Okay, so I did wash my hands and I put on my clean gloves. I have your vital signs going, and now I'm gonna measure the tube, okay? And I will give you this water to drink during the procedure. We'll do that in just a second, okay? I'll have maybe my coworker come in. So the first thing I'm gonna do is measure the tube. I'll work with this. Measure the tube from the tip of your nose to your ear, and then down to the xiphoid process. So we are at 45. Perfect, and then I add 15.2, so we're at about 60. Okay, so again, I will let you know it's gonna maybe a little bit uncomfortable, but it shouldn't be painful, okay? So maybe close your eyes and blink at me if you're in too much discomfort, okay? And we'll stop the procedure. All right. Put this chuck down, this clean chuck over here, so if it makes any mess. Okay. keep swallowing for me, okay? And I'm gonna stop a few times during it just to check and make sure we're going in the right place, okay? All right, so keep swallowing the water. Good job, keep swallowing. And I'm gonna look, make sure they are, okay, perfect. We're in the back of the throat. And chin down, please. Great, advancing to 30. And now I'm gonna listen in the tube for air. I don't hear any air, so we'll keep going all the way. You're doing a great job, Martha. All the way down to 60. Keep drinking, keep drinking. Okay, we are there. Perfect. Now, I'm going to secure the tube to your nose. With this tape. Is that uncomfortable at all? So, all right, you're doing good. No discomfort, okay. And then I'm also gonna tape it to the side of your face here, and then also onto your gown, okay? And I'm gonna attach it to the suction here. Make sure the suction is on and check to make sure it's flowing. So it is taped to the side of her face and then down to her gown. And I'll attach it with the valve here. And put it on the suction, and then I'm going to make sure it gets turned on. Make sure I do see visible contents, but first I'm gonna check and make sure with the suction off that we're able to aspirate for stomach contents. Make sure we're in the right spot. So I will administer 10 mils of air. All right, you doing okay? Hopefully this isn't too uncomfortable, okay? And then I'll pull back stomach content, take it out, and then I will advance this and turn the suction on. It sounds like it's going and I can see stomach content. Leave that there, and I'm gonna put this in the cup here, and then check for stomach acidity. So when we do this pH test, it should be fairly acidic. Looks like that is acidic for this patient, so that's good. Okay, so another provider ordered that we take the tube out, okay? This would probably be another day, hopefully. But I do have the pulse oximeter still on the patient, and we will have the patient take a deep breath, and I'll probably have new gloves at this point. And I'll untape it from her face. All right. So we're gonna do it in one fell swoop, but I'll make sure I turn off the suction. And I'll measure the contents and description of them so I can note it in their chart. Okay, I'm gonna have you take a deep breath and hold it, okay? We're gonna do it pretty quick, okay? 1, 2, deep breath. All right, okay, perfect. Well, we got that tube out. Now we're gonna do some oral care. I just wanna make sure we give you some water, rinse out your mouth, and brush your teeth if you'd like, and spit it. Okay, perfect. All right, Martha, I'll let the provider know. I'll document that we have everything in the chart, and if you have any questions or concerns, you can ask me now. But it looks like you did very great through the procedure, okay? All right, take care.